Hi, I'm Dr. Adatone Musa.
Hi, I'm Dr. Hussein Musa.
I'm a board-certified neurologist and seizure specialist.
I'm a board-certified anesthesiologist, pain doctor, and addictionologist.
Today, we are going to talk about gaps in healthcare and how direct care can address those gaps.
Now, why are we talking about direct care on Healing Talks with the Kingdom Docs?
Well, why?
Well, healing will allow you to function better,
Yeah.
and having more time with your doctor,
Yes.
having a doctor who can actually look into your history and create a wellness plan for you,
Yes.
that can promote healing. And I think it's very important, rather than the traditional healthcare system. Unfortunately, you have about 3 months, you get an appointment, you get a medication, you may get some
10-minute appointment, right?
10-minute appointment.
Yeah.
It may be longer because a lot of doctors, they're going to give you more time, but
That's
it's
true.
just their time. And
Yeah.
unfortunately, it leads to more burnout. And eventually, if you're burnt out, you don't practice anymore. So many patients lose out.
Yeah, wow. So the direct care model really fosters a healing environment with a lot of counseling, a lot of time with the patient, and that empathy and that compassion that's needed for healing.
Yes. I remember in the Bible, when you look at why Jesus healed,
Yeah.
you'll find that it was because of compassion.
It was,
He was
yeah.
often moved by compassion, and he started to heal the people.
And we want to inject that compassion back into the medical community, for
Yes.
sure. So we're going to be talking more about migraines and headaches. We did cover that in the last episode. There's so many different treatments for migraine, one of which is abortive therapy. Abortive just means a rescue medication like Tylenol, like Aleve, like ibuprofen. And these medications, unfortunately, can be overused by the general public.
Now, this is some real overlap, because a lot of my patients and who have dealt with chronic pain, by the time they see their primary care doctor, they're already on dangerous doses of Tylenol, like over 3 grams of Tylenol, and that's when you can start being concerned about the liver.
Yeah.
Now, depending on your own health status, it doesn't really matter what dose of naproxen and ibuprofen or Aleve. These NSAIDs can really affect your stomach or your gastric lining and also your kidneys.
Yeah.
And people have really developed ulcers and all sorts of GI distress, and it's because of their overuse of pain medicine.
Yeah.
So their pain has caused them another problem, but they don't even realize that it's the medications, the over-the-counter medications that they're taking for pain, that's causing other issues.
Absolutely. And it's not just complications from overuse, but it can also lead to more and more headaches. It's due to rebound headaches. It's a vicious cycle.
I was going to say the same thing. It sounds like a vicious cycle.
Correct. And so it's really important to connect with a doctor that really understands this disease process so that they can optimize your treatment plan.
Yes, and it's really important that your doctor has time to hear what medications you're taking. There's so many times that I see a patient, they're taking 2 different types of anti-inflammatories. They take ibuprofen and Aleve, or they take a strange sounding one like diclofenac and naproxen, or
The same medication.
which are like the same
Sister.
family of medications.
Yeah.
And they said, well, I take this one then, and I take this one when it's really hurting. And I said, you're taking 2 of the same family medications, and you're increasing your risk of end organ damage from this. And when
What
I
is
tell
end
them,
organ damage?
oh, I'm sorry. Well, you can affect your kidneys, or your liver, or your stomach
Yeah.
lining. End organ damage means that you're damaging one of your organs and it's
Over
usually
time.
from over time. And without that proper education, a lot of patients don't know.
Yeah. So it's really important to determine, well, how much of these medications should I be taking? And do I need a preventative prescription medication or something more complementary or holistic?
And that's why this direct care model, where you have time with your doctor, they can delve into a treatment plan, see what you're doing, and create a personalized plan for you.
If you guys want more information on this, visit kingdomdocs.com.
Thank you, and God bless.
Bye-bye.